Hey guys, it's Katla, and welcome to my channel. This is my 22nd episode after what has been just over a 3-month hiatus, also known as falling into deep void and then suddenly clawing out of it. That deep void is also known as grad school. And the COVID-19 pandemic starting to get better, and then Delta variant, and anyway, yeah. There's a lot going on. So, once again, I'm going to be talking about current events and the application of public health in this situation. So I guess let's get into it. Since I've been on a 3-month hiatus, I figured I would reintroduce myself. I am Katla. I am a public health communicator. I am not a medical doctor or a public health expert or public health official. I care about public health. I study public health and medical sciences, and I'm just here to talk about it. For my new subscribers, welcome. I am grateful that you're here. For my old subscribers, welcome back. I'm grateful that you're here. For anyone new who is stumbling onto this video, welcome. I'm also grateful that you're here. So as I said, I'm going to be talking about current events today. And that current event is the Taliban taking control of Afghanistan. And I know every other person and their cousin has had their own hot take about the situation on Twitter. So I'm just going to focus in on one very specific situation regarding foreign relations from the U.S. in Afghanistan and vaccinations. So one thing that inspired this video was a couple days ago, I saw this article, which is basically the Taliban bans the COVID-19 vaccine. This article was for a specific region. Presumably it's going to apply to the entire country. And so I figured I'd talk about why this group is anti-vaccine. Like, obviously, this is limit foreign influence. Most vaccines at this point are coming out of the U.S. Obviously, the U.S. isn't going to be exporting things to Afghanistan. Hopefully, I don't know. And there is an opposition to Western medicine. There has been a long-standing conspiracy theory that these humanitarian vaccination campaigns are actually meant to sterilize Muslims, and it's not great. Also, by letting infectious disease continue throughout a country, there is an element of general subjugation and terrorizing the people. Like, by not allowing people adequate medical care, you are controlling them. One thing I've learned in the context of global health in my public health studies is how the decision to care for infectious disease varies so greatly between totalitarian regimes. For example, in the Soviet Union, they were extremely proactive about infectious disease and stopping outbreaks the second they happened. And they had insane levels of disease surveillance, and they had an excess of hospitals and healthcare workers to be ready for anything because they wanted to maintain the reputation of communism, essentially. This is very much a simplification. This entire topic is its own video, but that's just a way to show that the long-term welfare of a country isn't really being thought about. So to gain the context of this situation, you need to remember that for years, these groups have been anti-vax, anti-Western medicine. There is the conspiracy theories. And while for a long time, it could be just brushed off as conspiracy theories, in 2013, it was declassified that the CIA used a sham hepatitis B vaccine clinic to collect the DNA of the people for a region in Pakistan that where they suspected bin Laden was hiding. That operation didn't lead to any good clues. However, in addition to all the other acts of war that killed innocent civilians, it arguably is leading to thousands more deaths over the coming years even, because of now people have proof that the CIA used vaccines for espionage. And there's just so many completely messed up things about this. So also, polio vaccinators go door to door to get each child vaccinated. So they also got accused of being spies and frequently were faced with violence. Even in the recent past couple months, 2 women were assassinated for being polio vaccinators. It's just terrifying to see that level of distrust and violence against people who are just trying to prevent disease that is vaccine preventable. Also, an additional thing is that in lower and middle income countries, including Afghanistan and Pakistan, a large portion of the healthcare workers are women. This is based in gender roles, essentially. Like, people want to put women in more nurturing positions. In countries that are developing, they will have all levels of healthcare, from nurse assistants to doctors, be women, because people will trust women more to care for them. And when we have regimes where women are barred from working, women who dare to work face violence. So that's when we speak about so many of the vaccinators are women. They're daring to work. They are meeting violence. They are risking their lives to help and save others. Within the years 2013, 2014, 66 vaccinators were assassinated. Like, I haven't found more recent data on vaccinator deaths, but that just gives you the idea of how frequently and how at risk these people are for daring to want to prevent devastating disease. So one thing I've learned recently is that the CIA claims that they would never have their agents pose as religious missionaries or journalists, to essentially keep those professions pure so that they are not suspected of being spies. Why weren't healthcare workers afforded the same courtesy? Arguably, healthcare workers are the people out there actually trying to save lives, and you just put a huge target on their backs. Like, this is something that just is so incredibly upsetting to hear about and to know. And the final bit of this is that wild polio is still a threat in Pakistan and Afghanistan. Recently, there have been dozens upon dozens of children who have been sickened with polio. These are the last 2 countries where polio is endemic and a genuine threat to children. It is restricted to rural areas generally, but with the Taliban barring COVID vaccines, I would suspect that polio vaccines are also barred too, amongst many others. There are going to be more cases and more deaths, and that disease is just going to grow again. People risk their lives to eradicate disease. And of course, foreign influence from the US has completely damaged it. We can talk time and time again about how short-sighted certain things are and how obvious certain things should be. But these things still happen. So many things still happen. And that's honestly part of the reason why I took the hiatus for 3 months. Like, I have grad school and I am incredibly busy. And I did have an uptick in other social obligations when more people were getting vaccinated in the US and we didn't have the Delta variant as an issue quite yet. But it's also because so many of these stories, so much of this research is just hard to do. It's hard to read. The documentaries are hard to watch because you end up seeing how much harm still exists today and how few people actually care. And well, that's all I have for you today. It's a quick video. I feel like my videos are going to stick to more under 10-minute marks now, as I am busy, and like when I produce a video, I'm just going to try and talk through it all. Might not be the most linear, so I might be scattered a bit. As usual, my sources are linked in the description below. And yeah, until next time, stay safe. Please wear a mask. Protect yourself from the Delta variant. Please get vaccinated. And I'll see you guys later. As I said, I study public health. My original background is in chemistry. I then did a post-baccalaureate to prepare for medical school, and that was focusing on medical sciences and public health. And now I'm currently in a Master of Public Health program, which I will complete and then hopefully go on to medical school and hopefully someday be an infectious disease specialist. Yeah, my 20-year plan is quite detailed. It's both good and terrifying, I guess. Anyway,